Hi friends, welcome to my channel Dr. Ghosh Presents. I am the creator of the channel Dr. Ghosh. I am speaking to you from Kolkata, India. We are going to start a new episode. I would request you to please follow this attentively. Today's discourse: Osteoarthritis. Title: If osteoarthritis is your problem, then you can't miss this video. What does a bony joint comprise? Two or more bones unite to form a joint. At each end of the shaft there is a soft tissue called cartilage. It reduces friction between two bones. Cartilages extend from both sides to opposite direction to form a box-like structure called capsule. Inner lining of it known as synovial membrane, which secretes synovial fluid to store it in the capsule. The fluid oils the joint. A tough tissue called ligament covers the whole joint from all sides to protect it, not shown in the figure. Besides, ropes-like structure called tendons are created from muscles on opposite side to get inserted into the head of the bones, not shown in the figure. Now, understand the picture. See these things. This blue line on head of the both bones, these are cartilages. These are very soft tissues. When we eat fleshes of birds, at the head of small bones there are soft tissues. We generally just chew it. That is actually cartilage. This cartilage. Now this cartilage, you see, from this side is extend to this side, and from this side extend to that side. So that in all it makes a cage or box. This is a box-like structure. This box-like structure is called capsule, and the red on both sides of this box-like structure, this red part is called synovial membrane. This membrane secretes a fluid called synovial fluid, shown here, just a light bluish, brownish yellow color. This is the fluid, synovial fluid. It actually oils the joint so that the bones doesn't erode. Bones do not erode. So this is the explanation of this figure. Another thing is also that from this side muscles extends and a rope-like structure comes and inserted here. From this side, muscle is this side, the rope-like structure comes here and gets inserted. This is called tendon. Similarly, from another muscles from this side, and the rope-like structure comes and get inserted this side. This is called tendons. These are not shown in the figure. What is arthritis? Inflammation of bony joint giving rise to swelling, tenderness and stiffness of the part is called arthritis. What is osteoarthritis? A type of arthritis where cartilages of bone is first damaged and then the ligament follows suit is called osteoarthritis. Let us see the figure beside. This is a normal joint. These cartilages and these cartilages are intact. Now see here, the cartilages on the right side, the cartilages has been damaged and erode out, and bony surface has come out. That is, the cartilages is damaged. Cartilages is damaged. Then thereafter the capsules, the overall the ligaments will be also damaged. So this is an example of osteoarthritis, where damage first starts from cartilage, then it moves to ligaments. How do you understand that you are attacked with osteoarthritis? That is, what are the signs and symptoms of osteoarthritis? 1. Tenderness, swelling and stiffness of any joint, especially felt when movement is started. Then difficulties gradually lessen. Again the same increase during the rest of the part. Number 2. Loss of elasticity. Number 3. Grating sound or sensation inside the joint. Number 4. Spar formation at the bony ends. Number 5. As time passes on, the intensity of the symptoms increases. How many men suffer from osteoarthritis? In our country, about 80 million people suffer from osteoarthritis. What is the reason of osteoarthritis? What is the reason of osteoarthritis? Due to long continued use of a bony joint or for some other reasons, the cartilage at the end of one erode out. Bony surface comes out from beneath. Then extra pressure is acted on the ligaments, capsule as well as bones, for which the joint swells up, gets stiff and tender with difficulty in movement. Thus, OA results. OA may also result from the following reasons. Number 1, from an old injury, most commonly seen in players. Number 2, owing to some profession which demands repetitive movements of a particular joint. Number 3, from wear and tear of old age. Number 4, from familial trends. Number 5, due to congenital defects. Number 6, from addiction of cigarette, wine and other, mental stress of daily life, continual loss of sleep. 7, being obese or overweight. Due to some diseases like gout, rheumatoid arthritis, septic arthritis, Paget's disease, etc. 9. Scientific researches have shown that low intake of vitamin D increases attack of osteoarthritis. Again, low intake of vitamin C aggravates the disease. What are the complexities of osteoarthritis? Osteoarthritis is a type of degenerative disease of bone. Unless managed properly with medicines, lifestyle and diets, the disease go on bad to worse, interfering with daily life of the victim. Finally, the joint gets completely out of order and he cannot use it anymore. But taken proper care of the disease, the situation can be kept under control, though complete cure is a mirage. Look the figures. Both the figures are advanced stage of osteoarthritis. This is the last stage of osteoarthritis. The joint, look the joint has been completely damaged, and sure the victim having such a joint is unable to move the joint. The same thing here also, the joint is complete damage. How do you keep osteoarthritis under control? Osteoarthritis is almost incurable, so keeping it under control is very much essential. We would follow a two-way approach. 1. Medicine. Many dislike modern medicine due to its nagging side effects. Nowadays, the 5 pathies of Ayush Department of Central Government are very much popular and effective too. You can adopt any one of them as per your choice. Number 2. Change in lifestyle. A lot of things mentioned above are under our control, namely taking of vitamin D or vitamin C in proper amounts, avoidance or shunning of addictions, lessening of mental stress by following yoga, simple exercises or joining laughing clubs, etc. B. Arranging for sound sleep for 6 to 7 hours a day, following proper diets and exercises, bringing down weight or obesity. If you cannot perform active exercises, passive exercises can do a lot. Passive exercises are those where a particular part does not carry any weight or pressure but performs simple movements. C. By minimizing red meat, organ meat like liver, stomach, eyes, animals, meats of birds, sea fishes, etc. All these increase uric acid in blood, leading to pain in joints. D. Taking water 2 to 2.5 liter per day. Last, I would narrate a personal experience of my own life. While studying in college in younger days, I got a severe injury on my left ankle. 3 years before, that ankle got attacked with osteoarthritis. Myself a homeopathic physician, so I started our medicine, which got considerable reputation in managing osteoarthritis. But I practiced long distance running, and I feel pain increased in left ankle next day whenever I ran 7 to 8 kilometers a day. A senior orthopedic surgeon advised me to stop running, but running has become an addiction to me. How can I stop it? I looked for some extra way to fight out the pain. Suddenly I came across an advice of Dr. Warburg suggesting a drink to stop chronic inflammation or arresting cancer cell proliferation. Fundamentally, I am a student of chemistry. I could follow the principles in preparation of the drink and its mechanism of action. Now I have been taking the drink for the last 3 months along with my medicine, and I am better by 80%. Just trust me, I am better by 80%. Now, what is the drink? How it is prepared? I have described this thing in my earlier videos about 10 to 15 times. Yet I will narrate this now also. I am not writing, I will just speak out. Just you take 2 tablespoonful of lemon juice in a glass. 2 tablespoonful of lemon juice in a glass and half teaspoon, that is tablespoon and a teaspoon, half teaspoonful of bicarbonate soda. Mix them, keep them for 2 minutes, mix 200 ml of water and take this drink empty stomach early morning 4 days a week. This will stop any type of chronic inflammatory condition, as I have felt and I have noticed myself. This is for you. You take it or not, but it's a fact. It's a fact. I am amazed to see the result. Thank you. That's all. Our presentation ends here. You have gone through the whole session. Now please give your comments as to the quality of this presentation. How this could have been much better, what should have been added, or what should not have been added. I will be waiting for you so that I can give you my best presentation in the coming days. Thanks for the time and attention.